I'm Nima Rajan, and this is Forum Daily Week in Review. The Canadian Institute for Health Information's latest data shows a spike in the rate of youth hospitalized for eating disorders during the COVID-19 pandemic. CIHI says girls aged 10 to 17 with eating disorders were hospitalized nearly 60% more following the onset of the pandemic. Dr. Liana Isserlin is the psychiatric director of the Child and Adolescent Eating Disorders Program at CHEO, a pediatric hospital and research center. And she says the number of hospitalizations is just the tip of the iceberg because so many more patients don't have access to care. Well, joining us now to talk more on this is Dr. Isserlin herself. Welcome to Forum Daily, Doctor.
Thank you.
So how has the pandemic impacted eating disorders among youth in Canada?
So youth in Canada have been struggling even before the pandemic with eating disorders as well as other mental health challenges. And we were struggling as a healthcare system to keep up with that long before the pandemic struck. And then with all of the stressors that have occurred for young people during the pandemic, we have seen a significant increase in young people presenting with eating disorders, as well as a general deterioration in the mental health of young people.
And you say the numbers by CIHI are just the tip of the iceberg. So can you tell us a little bit more about this?
That's right. So the CIHI data represent the hospitalizations for young people with eating disorders. And that's really important data. It's reflected in what we've seen here in our center. Clinically, we've seen the increase in patients presenting with eating disorders at 220% of what we had seen before the pandemic. However, just looking at the hospitalizations doesn't tell us what's actually happening in the community, because many young people with eating disorders don't reach the point of receiving hospitalization or even receiving care.
What do we know so far about the causes of eating disorders among youth, especially during this pandemic?
That's right. So we know there are many risk factors for eating disorders, including genetics, societal pressures, other stressors that young people come in contact with as they move through adolescence, which is the time when people are most vulnerable to developing a new onset of an eating disorder. And then when it comes to the pandemic, we saw unprecedented incidents of isolation, transition, uncertainty, change, as well as exposure to screens and social media as really the only form of staying connected to the world. And all of that has had an impact on young people and increased the risk of developing an eating disorder.
And I'm sure the parents and guardians watching this right now want to know how they can identify if their child or adolescent has an eating disorder. So what types of eating disorders are there?
So there are many different diagnoses of eating disorders, including the classical eating disorders of anorexia nervosa and bulimia nervosa, but there are also other types of eating disorders, as well as young people who don't fit into a specific category, but have significant eating challenges that are impacting their physical health. And ultimately, at the root of the eating disorder is this sense of not being good enough and transposing that onto their body and trying to change their weight and shape in order to feel sort of good enough for the world, to raise their self-esteem and to be able to feel in control of their lives again.
So what steps can loved ones take to treat eating disorders among youth?
That's right. So loved ones are really important team members in the treatment of eating disorders. They're critical in being able to support their child or youth or even adults loved one with an eating disorder and at home. And it's also important to be advocating for increased resources and supports, because we know that we have a critical shortage of resources available for young people with eating disorders.
Can you tell us a little bit more about these resources that are needed and what officials can do?
That's right. So we need resources for young people at all different levels and all different areas of children's health. Children's health has been chronically underfunded, and we're really, just trying to catch up with what we've needed for a long time. So we need officials to really make a big investment in children's health, to see it differently than adult health, and to recognize that an investment now in children's health is an investment in our future, because these young people, if they don't receive the care that they need, will go on to have chronic eating disorders, just like they will go on to have other chronic diseases, which will be lifelong if they don't receive timely care at this time.
All right, Doctor, just about a quick 30 seconds left here, but what are the current supports available for Canadian youth with eating disorders?
That's right. So we have many different levels, including things that they can access on the internet, our National Eating Disorder Information Center, There are community support centers in many large centers, and there are hospital-based systems, as well as children and family community mental health supports often have resources for young people with eating disorders. And, accessing your family doctor and pediatrician is always a good start when you're concerned about your child.
Dr. Isabelle, thank you again for joining us today on Forum Daily.
Thank you very much for your interest.
All right, up next, a look at National Nursing Week, an interview with the president of the Canadian Nurses Association right after the break. Stay tuned. After over 2 years of the COVID-19 pandemic, dealing with an overwhelmed healthcare system, COVID infections among staff, and constant burnout, Canadian nurses are sharing their thoughts during National Nursing Week, with this year's theme being We Answer the Call. And they've been answering the call throughout one of the most difficult times for the healthcare industry in history. According to the Canadian Nurses Association, the pandemic brought to light the courage and commitment that nurses exhibit every single day, and it highlights their commitment to their jobs. Well, joining us now to tell us more about Nursing Week and the important roles that nurses play in the healthcare system is Mr. Sylvain Brousseau, President of the Canadian Nurses Association. Sir, welcome to Forum Daily.
Thank you very much for the invitation.
So after over 2 years of this pandemic, what is the current state of nursing in Canada, especially considering the more contagious variants of COVID?
As you know, nurses are simply in burnout, exhausted, and some are experiencing psychological distress and are demoralized. And we also know that according to the Canadian Federation Nursing Union, 94% and a non-precedented number of nurses are experiencing symptoms of burnout. This is a lot. And over 50% of nurses are considering leaving their jobs over the next year. And this is very major. And according to a 2022 CFNU research survey, 70% of nurses say that their workplaces are regularly over capacity. And once the COVID-19 emergency subsides, those same burnout nurses will have to work on the large backlog of medical procedures related to the pandemic. And what we are very preoccupied, it's the fact that we need more nurses. And a lot of those are going to leave their job.
And as you're saying, we have concerns around a potential chronic understaffing of nurses in Canada. What would you say are the key reasons behind nurses considering leaving their jobs right now?
First of all, as you know, before the pandemic, nurses face difficulties regarding their workplace, such as facing unbearable workloads, unsafe working conditions, such as increasing patient-nursing ratio. Many have faced 16 hours and plus shift and have not been able to take a day off or break, have had their vacation suspended, and are facing chronic understaffing and underfunding. Nurses have been sounding the alarm for many years on these issues long before COVID-19, as I said, and now the reasons behind the shortage of nurses have been exacerbated by the pandemic. According to an article published today from Silas and Villeneuve, we were already short of nurses when the pandemic began. Then its demand drove many people out of the profession. According in the same article, in the fourth quarter of 2019, Statistic Canada data showed that there were 10,575 job vacancies for registered nurse and registered psychiatric nurse. And this is a lot. Though 2 years later, the number had more than doubled to 22,955 job vacancies for licensed practical nurse, also soared, growing from 3,710 to 10,765. Overall, these numbers have been an increase of 123% increase in nursing vacancies. This is a lot. And for many, the only relief has been to leave their job or profession or work in other nursing area.
All right, sir, just about a minute and a half left here, but what steps need to be taken to address this growing issue?
First of all, we must improve the working condition. We must have more flexibility in the workplace. We must humanize the way the environment is what the nurses want. It's adequate staffing level, decent working condition, and they want also a more adequate ratio. You know what they want to do? They are leaders in the quality and safety care, and they want to give safety care. We must also take action to help recruitment and retain healthcare workers. It's very important. It's urgent, and we need to improve, provide free mental health care for the nurses, student loan forgiveness, hire more administrative and support staff, and implement strategy to maximize the nursing scope of practice. And I will also add that we need to provide child care support, such as hospital-based daycare to help nurses. And also, I would also add to finish, increasing capacity for educating and training more nurses.
Up next, we'll have an interview with Dr. Isabelle Smith about Canada developing a national autism strategy. The push for Canada to develop a national autism strategy is taking another leap forward. A report released Tuesday outlines the structural and systemic gaps facing people with autism and their families. Dr. Lonnie Zwagenbaum, the chair of the oversight panel that produced the paper, says a national strategy would provide a central vision in addressing social and economic barriers for people with autism, as well as their families and caregivers. Much of the study is also dedicated to highlighting the need to understand more about autism among Indigenous peoples. Well, joining us now to talk more on this is Dr. Isabelle Smith, autism expert and professor in Dalhousie University's Department of Developmental Pediatrics. Dr. Smith, welcome to Forum Daily.
Thank you very much. Thank you for having me.
So what are the structural and systemic gaps facing people with autism and their families in Canada?
I think a big one overall is the lack of recognition of the diversity of strengths and needs among autistic people. Autism is a spectrum itself, aligned with different levels of ability and disability. And then that intersects and overlaps with all the other sources of diversity among us all, gender, race, culture, all of those things. So we're talking about a large population with very diverse needs, and we're falling short. So that's a big one. I think another really big gap is in the disparity in access to services across the country. So, depending on where you live in Canada, you might have access to really quite different services if you're an autistic person or a family member of an autistic person. And I think that's something we really need to address.
All right, Doctor, let's talk solutions. What are these key recommendations from this report in terms of addressing these gaps here?
Well, I think there are recommendations around a number of areas. I think in general, increasing acceptance and understanding of autism and needs of autistic people through, concrete actions like increasing access to supports, funding sources for, various needed services. A huge need for capacity building in our healthcare system in particular, both to address diagnostic needs, and very long waiting lists for diagnosis, and access to mental health supports, because there are distinct mental health needs that are common among autistic people. Another key recommendation is really to increase the focus on autistic adults, because many of us, when we think about autism, think of children, think of the needs of autistic children, and that's where a lot of our services lie. Even those, we have disparities across the country, but when it comes to autistic adults, we really, people really fall off the cliff. We really don't have the kind of systematic support supports that are needed for this growing population.
It's clear there are a lot of diverse needs when it comes to people with autism. Now, the study also highlights the need to learn more about Indigenous people who have autism. So what do we know so far about their unique needs?
Well, that's the thing. We know very little, but this is a big step, because this report really went out of its way, the framers of the report, to engage Indigenous autistic people and their supporters, family members, and so on. So I think what we've learned is that the big thing is that all of the challenges that are faced by other autistic citizens are amplified for Indigenous Canadian autistic citizens because they're, again, that intersection with, the disadvantages that are often faced by those groups. For example, even feeling comfortable approaching the healthcare system if you've previously encountered stigma in that arena. So I think it's, we're just starting to learn. We're learning with Indigenous autistic people, and I think we've got a long way to go.
A lot of research to be done. Now, we've got about 45 seconds left here, but many families have been calling for support for years when it comes to autism. So how close is Canada to developing this national autism strategy?
We're a huge step closer now that we've got this report, because this is a first step that brought together, a huge number of voices from across the country, from all kinds of communities, from families, autistic people, researchers, clinicians, policy people. So that's a step that will allow us to now start building what are the supports that are needed. These recommendations that have been made are a first step. And then we need to enact these recommendations, to make active changes that address the needs of autistic people. But now we have a way to get there because we've identified what some of the issues are.
All right, Dr. Smith, thank you again for joining us today on Forum Daily.
Thank you.
Stay with us. We'll be right back after a short break. South Korea's new president says he'll present an audacious plan to improve North Korea's economy if it is denuclearized. Yoon Suk-yeol made the offer during a speech at his inauguration ceremony in Seoul on Tuesday, but North Korea has previously rejected similar offers. All of this comes amid provocations from North Korea, including what South Korea says was a submarine-based ballistic missile test on the weekend. Well, joining us now to discuss the political state of the Korean Peninsula is Mr. Anthony Ruggiero, who was previously the U.S. National Security Council Director for North Korea. He is currently a senior fellow at the Foundation for Defense of Democracies. Sir, welcome to Forum Daily.
Thanks for having me.
Now, firstly, what do we know so far about South Korea's new president, Yoon Suk-yeol, and his priorities for the country?
Well, he's a political newcomer. He's a novice. He only won the election by less than 1%. It represents a change from the progressive to the conservative parties. And in South Korea, they're elected to one single 5-year term. So he does not have to worry about running for re-election. He talked about wanting to make South Korea a global player along the lines of its top 10 economy status. But of course, things closer to home will keep him busy.
I want to quickly jump to an op-ed published in the Dispatch today where you indicate that this new president might have to deal with Japan and China in addition to North Korea. So can you unpack this for our viewers?
Well, definitely. In 2017, South Korea under the previous president had a missile defense system because North Korea is doing missile tests, which seems like a reasonable response. But China was not happy, so they tried to use economic coercion against South Korea. So he's going to have to deal with that because during the campaign, President Yoon now said that he wanted to deploy additional missile defense systems. And then in Japan, there are a lot of historical differences, which has caused a lot of tension, especially in the previous administration. He's going to have to work on that. It was good to see the Japanese foreign minister was in attendance at his inauguration earlier today. So that's a good sign.
And we mentioned this audacious new plan Mr. Yoon wants for North Korea if it denuclearizes. What plan is this?
Well, that's unclear. The pieces that he talked about in his inauguration speech, he said the right things, at least from my ear, that when it comes to denuclearization or economic incentives, those would only come after North Korea has made some steps toward denuclearization. Hopefully those are irreversible. What we're seeing today is that North Korea is reversing some of the steps that they took under the Trump administration. For example, the explosions at their nuclear test site. It's possible North Korea does a nuclear test this month. So that just reinforces why we need irreversible steps.
And we know previous attempts to denuclearize North Korea have all failed. So what would make this time different?
Well, that's a great question. We've been dealing with this for 25 years. Part of the challenge is that I think people focus on pressure or sanctions is usually how people frame it, or engagement. One of the few things we have not really tried is to try them both at the same time. So we'll see. I think Yoon is focused on it. The real question here in my mind is the Biden administration. They're so focused on other foreign policy priorities, understandably so, given that there's an actual war in Europe. But we can't lose sight of North Korea and their threat not only to the homeland, but their threat to South Korea and to Japan.
Now, these are really concerning missile tests, including considering the range that these missiles have. So what message is North Korea trying to send through these missile tests?
Well, Kim Jong-un in January 2021 laid out some of the steps that he was going to take, and it seems that he is following along that pathway. I like to say that he's okay with the status quo. In other words, he has a plan. Different things happen. So Biden is inaugurated. The war in Ukraine happens. Yoon wins the election and is inaugurated. All these things actually work to Kim's favor because he can continue with very little pressure on him. So he's actually, so part of what we need Yoon and Biden and other countries, like-minded countries, to mix it up and to make him uncomfortable. And we haven't gotten there yet.
All right, Mr. Ruggiero, a quick 20 seconds left here, but what are you watching for next?
Well, I think a nuclear test is probably possibly this month, but it's always difficult to predict what North Korea is going to do.
Mr. Ruggiero, thank you again for joining us today on Forum Daily.
Thank you.
All right, I'm Nima Rajan. Thank you for joining us today for the Forum Daily Week in Review. We'll see you again next time. Have a great weekend.